Good evening, all, and welcome to one more transformation of Empowering Divas. Today, I am with Dr. Neeru, and let's see, in her own words, how she found Empowering Divas Hub as her companion in her transformation journey. Welcome, Dr. Neeru.
Thank you.
How are you? Tell
Good.
me about your profession, your age, and the first of all, the symptoms which made you to join this Empowering Divas Hub?
Actually, I'm a physiotherapist. I'm working in the field of rehabilitation from last 30 years. I have my clinic also, and I work in a multi-speciality hospital in Delhi. And I'm very active. And as a physiotherapist, I know what to do and what not to do medically also. But somehow sometimes you fall in a trap and you don't know how to get rid of it. So at the age of 50 I started with my perimenopausal symptoms. It started with my high blood pressure,
Mm.
for which I started taking medicine. But at that time there was not much of the symptoms. It's only that my cycle was alternative,
Yes.
and I had started having high BP
Okay.
and weight gain, of course. Then, after 1 year of perimenopausal, of say 1.5 year of perimenopausal, I stopped with my periods. And for 1 year again, it started getting like that. It's
Mm.
only that I had weight gain and I had joint pains and very low energy levels. Joint pains, I used to manage it with my, I'm a physiotherapist, so that
Yes.
was not that big issue. But of course, it was nagging every time. Like I have to keep on doing something or other thing for me. And being a physiotherapist, actually, you can't tell anybody कि मुझे joint pain हो रहा है. वो बोलेंगे तो ठीक कर लो.
Yes, yes, of course. That
So
hurts
that
us.
sometimes, even though if you are having pain and somebody is saying mujhe pain ho raha, so you have to correct them instead of yourself.
Yeah,
It's
yeah.
like
I can
at times very irritable,
correlate.
but
Yes, yes.
still it was going on. Last year, I went for a trip, and that was hectic trip. It was last to last year, and that was very hectic trip. And on the way back from that trip, in my plane journey, my knee suddenly gave up and it
Okay.
kept on paining, and then there was a
Oh,
ligament injury, so there was less movement again. And also, like, I'm a lower one leg amputee, so I
oh,
actually can't do much of the physical
yeah. Yes.
strenuous exercises. I just
Mm,
could, but still I do yoga, I do
mm.
stretchings, I do cycling, but not strenuous cardiovascular
Yes, of
thing.
course,
I
of
can't do
course.
that
You can't do.
because of
Right.
my physical limitations.
Yes.
So after that, still I was doing it. But last year again, I visited abroad for 1 month, and we had a gala time there. We visited so many places, and if you go abroad, you have to
Yes.
walk so much to see the
So,
places and all that. And
right.
that time I did not realize, but when I came back within a week, I was like I was so bad condition. Every symptoms of however it was like 1 year after my menopause, but every symptoms hit at me, like flashes, hot flashes,
Backlash.
and depression and joint pains and weight gain. And I was in such a terrible condition. I was not able to help myself. And because I was visiting, I was on holiday, I ate a
Mm.
lot, and that was
Yes.
also the reason. And then there was my family there. So I came after meeting my family. So
Mm.
that part is also there.
Yes.
But I just started looking frantically for an answer, what to do. Usually I take homeopathic medicines
Yes.
for my my things. I believe in
Mm.
homeopathic.
Mm.
So I visited my homeopathic doctor also, but that was also not of much help. Then I started looking for help groups. Then I just hit at this group, and then I had a chat with Dr. Purvi in very much detail for almost an hour at that day, and then I joined the
So
program. I thought that
you took that one-on-one free consultation, right? And
yeah,
where we sat
yeah,
together on a Zoom call, same like this, and you
Yeah,
You
yeah.
told me, oh, this is
Because
the
I was not
things.
sure of that,
Yeah.
without medicine or without anything, if
Yes.
anybody could help me on the earth. So
Hmm.
I took that one-to-one consultation with you, and in detail, we discussed
Yes.
everything, that these
Yes.
are the problems and how we are going to help it. And you were good enough that, of course, coach will help me in, however,
Yes.
like I on joining me the physical exercise
Hmm.
program.
Hmm.
We used to like I used to implement in my way, whatever way
Yes,
I
yes, of
do.
course. You have to modify it in your way.
Then I started with, of course, restricted diets. I
Hmm.
honestly speaking, I did not follow 100% any time, but yes, 50 to 60%. I was off wheat, onto the millet diet,
Right.
then onto the intermittent fasting,
Yes.
and in last 4 months, honestly speaking, I still am eating whatever my eating window period is. I'm eating everything. I'm taking Meta also. I take from 4 tea to I've reduced to 2 tea, but not less than that.
Right.
And but I added millet a lot into
Hmm.
my diet.
Hmm.
Salads and all that, fruits I can't take much because I already have IBS, and
ABS, right.
that always trigger my IBS. So that part I
Right.
can't do. But yes, gradually I've lost 8 kgs of weight and a lot of
Oh,
inch
great.
loss,
That's great.
and my face started glowing.
Yes,
And
that
nowadays
I can
people ask
see.
me कि क्या लगा रहे हो? I said कुछ नहीं लगा रही,
That's
बस
the
अपने
inner
आप
glow which is now
रहना. Yes,
coming on your
actually.
face.
And with
Right.
then I started doing meditations, and then mindfulness eating
Yeah.
was the very important aspect which
Uh,
I started doing. कि अब
Right.
ये खाना है तो कोई बात नहीं, खा लिया तो but next पे नहीं खाना है.
Yes.
And I reduced my portions. I
Right.
switched off to the millets and to the other options. And of course, intermittent fasting helped me with my acid. I had lot of problem with due to IBS. I had
Yes. Yes.
acidity
Of
and
course.
dyspepsia and
These
things like
steps.
that.
Hmm.
That also helped me a lot. I don't have that much of acidity now, unless or
Oh.
until I overeat. So now I know where I have to stop
Hmm.
and what I have to
Hmm.
do.
Hmm.
Then, because of weight, because of depression, because of
Hmm.
all the things, I was, going low. My work levels were low. I was not feeling like to talk, to go to anybody, to try new dresses. But
Hmm.
gradually, that's coming back again with,
Wow.
with
I can
with your
still
good
remember.
physical appearance and with your good mental balance.
Right. And I can still remember in our one-on-one call, you told me that I want someone. ना ऐसे डंडा लेके कोई खड़ा होना चाहिए मेरे पीछे and I
Actually,
need support badly.
actually.
So did you find that specific support from me and our community empowering Divas Hub? So how we helped you to overcome all your mental hurdles and challenges?
The best part is like that you take so much of effort of the like we meet online often. So when you ask and the other people respond and they're showing the positive response, you feel you get encouraged that of
Encouraged,
course others are doing.
motivated,
I can do
yes,
that too.
yes, yes.
And
That's the
like
power
the
of
journal you
community.
have
Yeah,
given, however,
habit tracker
honestly
journal.
speaking, I'm not very regular, but yes, it's
Yes,
on my bedside.
yeah,
So
that's great.
yeah, it's like that. Don't do this and just switch
Hmm.
off the media,
Hmm.
and just give yourself some attention on your physical
Hmm.
appearance, on your skincare, on your
Yes.
goals, on your
Hmm.
that really helps. I mean, day to day, if somebody is pinging you.
Yes.
Otherwise, it's like कि अगर आप friends को भी बोलोगे अरे मेरा weight gain हो रहा है मुझे अरे कोई बात नहीं ठीक हो जाएगा कोई बात नहीं. And like if I tell my husband, he says कोई बात नहीं होता
Good.
होता है it's okay. But ये
Right.
होता 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 इतना
हाँ,
आगे होता
कितना
जाता
होता
है
है.
कि there's no turn around. So
Yeah.
for turning around, you need a somebody to जो
Hmm.
will just give you a jerk, a big jerk. You come
Yeah.
on, get up. It's not turn. It's
Yes.
not good.
It's
It's
not
not good.
good,
It's
right?
a
It's time
disaster.
to take care, take
Take an
change, and
action.
make
Take
an
an action.
action.
Right.
That's make a
Yeah.
lot of difference. So
Yeah.
can you share a memorable experience or in any interaction with me or with other empowering divas hub member that stands out for you? Like anything, any memorable which inspired you more than any other days. to take this action, which you are like
Yeah, like
forcing?
the one thing was like the first meeting we had and the problems I discussed in detail with you when you said that everything will be taken care of, and yes, that
Yeah.
was taken care of. And in the meetings, when people say that, yes, we lost this much
Mm,
and we are
mm,
happy and now we are having better sleep, we are going to do, then of course that encourages. Then the last week when you started that mindfulness programs, that
yes, yes. That
step by
daily
step,
standing, yeah,
one
exercise,
one
mindful
to
exercise. Yes.
yeah, mindful exercises, so that
Mm,
like one-to-one day activities, it's like that, yes, I have to stop myself, or I have to stop
yes,
dreaming, or I have to stop thinking about my past, or
yes.
mm, connection with my
Own
my
self.
relations, my
Mm,
friends.
mm,
And then Hopinopo, of course,
yes.
helped. I mean, that is like something like you can just disconnect from your past and disconnect from your guilt and disconnect from your mistakes, and then
Yes,
kind of support to yourself first, because if you are happy, you're not in gloom, you are not in guilt anytime, then
yes.
it's like. And most
Oh,
of the time, now I felt like that we eat most of the time out of guilt, or
hmm.
most of the time out of stress. Like, I'm a
Yes.
stress
And
eater.
then we are more
So
happy, then also we do party. And if we are
yeah,
sad, then also we eat more.
and
Emotional eating.
in happy time I don't eat much,
Okay.
but I'm a stress eater. Then I kept on
Okay.
binging, binging, binging. That
Right.
binging thing, I've actually stopped
Hmm.
it completely.
That's great. So, what is your piece of advice, or valuable advice to other women who are watching and getting inspired by you, by your transformation, to join this empowering
I
divasa?
I would say कि never neglect yourself first thing. I mean, ये होता है, जैसे कि हमारी मम्मी से कहती थी,
Yeah.
कोई बात नहीं, होता
हाँ,
है, ये
हमें भी
सबको
हुआ।
होता है।
हाँ, हमें
हाँ,
भी हुआ, तुमको
ये
भी होगा।
हमें भी हुआ था, कोई बात नहीं, ये ठीक हो जाएगा। ये कोई बात
राइट।
नहीं करते करते हम उस पॉइंट पे पहुंच जाते हैं जहाँ there's nothing turn around. So
एग्जैक्टली।
if you'll just catch at the first point, if you know actually what exactly your body is going to undergo, what changes. Because I was a
एग्जैक्टली।
medical professional, for me the
हम्म।
things to understand was easy. But the
यस।
people who are not, the simple
हम्म।
housewife or somebody from
Some
computers
working
or
professionals, right?
non-professional from non-medical field,
Non-medical field, right?
sometimes it's very confusing for them ki what's actually happening to them.
Exactly.
And if you don't know what is actually happening to you, then it's like you can't cure it. If you don't know the disease, you can't cure it.
Yeah, of course.
So
That's true.
that is very important. For that, I think empowering diva plays a very great role in, telling that yes, this is happening due to this, and then we can correct.
Yes.
Because hot flashes is something, it always manifests in every person in a different form. And
Yes.
people even don't know it. I remember in my perimenopause, that was the COVID time. And I was
Oh.
a COVID warrior at
Hmm.
that time. So
Okay.
I was having hot flashes, और मुझे लगता था मेरी anxiety is due to because I'm working with COVID, and then
Hmm.
I'm coming back home, my family security, my security, people dying in front of me, so much of workload, then
Yeah.
TP. It's like मुझे लगता था उसकी वजह से हो रहा है,
उसकी
but
वजह से
now
हो
I
रहा है।
realize it was COVID also, but that COVID anxiety and the perimenopause both hit me very badly at that time, which I
Okay.
was not aware, that I
Hmm.
later on realized. But I
Hmm.
realized, but I'm sure there are many people who don't even realize it.
Yes, that's it. That's the thing that
So yeah, so
in
that
our
step
India, so
by
many women are there who don't
yeah,
know, who don't able to
definitely.
recognize that why this is happening with them.
Why it's happening. And like I get many of the people कि मेरे को हो ही क्या रहा है, मैं तो अच्छी
हाँ।
भली थी. Then I tell them, don't worry, it's part of your cycle. और फिर then the next question is, अरे मैं हमेशा ऐसे ही रहूंगी? No, ऐसा कोई भी नहीं रहता, हमें भी होता है, and we have
Right.
come through it. So that way it helped actually with my profession also. Now I am able to understand that why these ladies are having joint problems
Yes,
so
yes.
currently, and what kind of situation they are going on,
Right.
so I can help them. क्योंकि पहले तो मुझे समझ ही नहीं आता था कि
Hmm.
इतना तमाशा कर क्यों रही है ये, मतलब when I was not with that phase, तो इतना क्यों ही शोर मचा रही है, इसमें कुछ नहीं
हाँ,
है, ये ऐसे ही शोर
right.
मचा रही है. But now I realize that
Ah,
yes, of course they are in pain,
they are
and if
like
you realize other
physical,
person's
mental,
pain,
emotional, all pain come
everything,
together.
everything,
True.
everything. They're crybabies and
Yeah.
cribbing and bitching and
Yes,
मुझे लगता था
yes.
उफ मतलब ये क्यों ही आ गई at times लगता है क्यों ही आ गई I can't help her because if you are not mindfulness
Aware.
about your situation
Hmm.
actually no doctor on the earth can help
Can't
you.
help you.
So now
Exactly.
I think that helped me professionally also to understand other people also. So that's also for me it's a feather in the cap.
That's great. That's great. So, any more advice to join this empowering divas hub?
Yeah, I would say that if you're having some changes and you're confused about your situation, which I'm sure more than 75% of females go through it, then we need a complete program which help us to understand our medical, physical, emotional situations. Then only we can cure it. And of course, empowering device, the program which is going to help us with that, because even though if we know we don't know, because if we go to the gynae they'll just do their basic test, and
Yes.
at most if we insist them they give you put you on the hormonal pill, which is not a good
Yeah.
idea for anyone.
Exactly. The HRT
So
thing, we can get rid from the symptoms without using HRT. And it is
any
possible.
HRT or any pills for that matter,
Yes.
it's your body is undergoing change. You have to understand it, you have to heal it, you have to clean it, and you have to go through this phase happily to so that your coming age, especially because all of us like usually in 45 to 50 to 55 people get this, so we are progressing towards our old age
Yes.
also. So at this point of time health is very important to maintain and to be stress free and to be medicine free. That's important.
Right, right. So, last question, only three things you feel that transformed at your physical, mental, and emotional level. The three things which you are now having in your life, and because of that, you feel uh, a shift, a positive shift in your life
First
at
thing
this
is the
stage.
mindfulness, of course. First thing is the mindfulness. The second thing is your physical aspect due to your menopause or perimenopause. You should know actually that this is happening because of this. Instead of running again the battery of tests and having supplements and all that. And third, the right amount and right portion and right uh, diet to help it. I think these are the three things which helps you a lot. And of course, that your mental balance, your
Yes.
positive, um, because most of the time this also happen. Oh my God, अब तो मेरे periods रुक गए, मेरी तो जिंदगी खत्म हो गई.
Yeah,
These are the dialogues. We
right.
think, actually we think. So it's not कि जिंदगी खत्म हो गई. It's like I sometimes say it has restarted again. So now
Yes.
we are tension free of every month cycle coming, and those changes in
Yes.
body and your stomach aches and body aches, and you don't have to do this, you don't have to do this. I feel I'm
So,
recharged again. It's now
so
I'm tension
right,
free.
yeah.
कहीं भी
So
जाओ कभी भी जाओ.
after becoming a member of Empowering Divas Hub, your whole perception, looking towards life, situation regarding this physical issues, this hormonal imbalance, have changed.
Yeah,
Now
absolutely,
you are a
100%.
different Dr. Neeru, the one who I met before a few months. She was like so much frustrated. As in
Yeah,
a,
I was. I
I
was.
need help. I need support. Just help me out. And you did it. You did it.
Yeah.
I'm so proud of you and
Thank
really
you.
happy for you to
I'm
see,
I'm
watching
so
your
happy
face
that I've
glowing
joined
day
you
by
and
day.
have come through this actually mess up. I was messed up at that time and I was like कि मैं कैसे चलाऊं अपनी जिंदगी आगे, मैं काम कैसे करूं? I have so
You were
much to
like
do
little
in
bit
my life अभी.
angry and frustrated. I was like, oh my God, she need
Help.
immediate help, you know?
Yes. I needed it that time and
Yeah.
I'm much better now, and I hope things will sink in
Yeah.
more gradually with
More,
time.
more, more.
But
There are
I
new
believe,
things coming up in Empowering Divas Hub, new
yeah,
programs, new learnings. So
yeah.
I would love to empower you all.
Actually, every day is a new learning, I would say.
Yeah, yeah, that's true. That's true. So thank you so much for
Thank
coming
you so much,
on
Dr.
my
Purvi.
channel.
And I would suggest everyone who is just watching it, just join the program. It does not cost much, but it really saves much.
Yes, the all medical expenses which they might have
Yes.
to
And more
give
than that, I mean,
later
your wish
age.
to live, you wish to. I mean, I think after menopause and after, children grown up and your family responsibilities are less, we
Mm.
should enjoy more. But because of all these hassles, we
Yes,
stop
physical
living life.
issues, we can't enjoy the life, right? That's very
We
true.
stop living life.
Exactly. So, all of you are watching. We will meet one more time, once again, with another Divas of Empowering Divas Hub. Write in the comment box if you have any question, any query regarding Empowering Divas of any of your menopausal issues. I will give you answer of all the queries you write in the chat box. Thank you so much, Dr. Neeru, for coming here
Thank you,
and
Dr. Purvi, for
giving all
everything.
the motivation to all the viewers who are watching this interview, and it will motivate other women to take care of their health and take charge of their health.
Yes,
Thank you
that's
so much.
important.
Thank you.
Thank you. Thank you so much. Bye bye.